but it is a little afternoon, so at my time anyway. So we'll go ahead and get started with our Dairy Goat webinar series. Thanks for joining us today. Want to thank you for hanging out with us this past year with the Sustainable Dairy Goat Agri-Systems webinar series. This is part of our USDA funded grant project that we're working on. So if you want to learn more information about our project, you can go to dairygoagrisystems.org and see the project team members there and the different components that we're working on within that grant project. And this is part of our educational outreach part of the program. So we do offer these as a monthly webinar. And so we'll have one more coming up here on December 17th, talking about dairy goat milk quality. And this will be with a specific focus on the southeastern United States, as they had a dairy goat project with the University of Tennessee that they were working on. So we hope you can join us for that one. And then when I do the evaluation link here today, if you have topics that you want to learn more about coming up in 2026, I am taking topic ideas so that we can put together a webinar series for that for the upcoming year. So again, you can put those in the chat if you want, if you have some ideas as well. But today we're going to be talking about managing reproduction to maximize production. And so we have with us Dr. Rosie Busch. She's a sheep and goat extension veterinarian with the UC Cooperative Extension and the UC Davis School of Veterinary Medicine. She received her DVM from UC Davis and joined a rural mixed animal practice in Hollister, California, before returning to UC Davis to complete a residency in large animal internal medicine, focusing on livestock. She has years of experience, practical experience working with the livestock medicine and surgery service at the Vet Med Teaching Hospital, teaching students and residents. And then she went on to work for the California Department of Food and Ag with the team of scientists developing evidence-based resources for vets and livestock owners on antimicrobial stewardship. And as part of her extension role as veterinarian, she's currently collaborating on a number of studies looking at practical approaches to improve young stock survival, maternal health and longevity, and impact of integration into non-traditional grazing systems. So thanks for joining us here, Rosie. And with that, I'll let you take it away talking about managing reproduction here today.
Thank you so much for the introduction, Jen. And so we'll get started here. So we're going to be talking about reproduction and some different strategies and opportunities that we have. I always like to start with the why. Obviously, for dairy goats, we need to breed them in order for them to come into milk. So that's kind of the, no-brainer. Yes, of course, we need to breed our animals for that production purpose. But also, this is when we talk about managing reproduction and being intentional about reproduction. Here's where some opportunities come out where we can improve and do things like you always hear breed for a better animal. So that includes genetic selection. We can be intentional about our breeding pairs and how we approach that, or buck selection. When we have strategic and intentional breeding programs, it can lead to more efficient use of labor and feed resources. We can better assess or diagnose fertility issues in females. We'll talk about that. With planned procedures during pregnancy, scanning for pregnancy diagnosis, doing, dry off vaccinations, or just plain timing our dry period is really helpful when we have more informed strategies around breeding season in general, breeding season or breeding groups. It is also really important for kid rearing, because if we can be really intentional about our breeding program, what happens with that is that then we can be more prepared and more strategic around kidding season. This means that we may have better labor capacity, better infrastructure and resources around our kidding time so that routine procedures happen routinely, which can, if you've ever been on some of these large farms, sometimes those things can go by the wayside because we're just, overrun with all the kids that are coming in, when we kind of just let natural breeding season occur. So there's some of these strategies can help us be a little bit more prepared and intentional about that season as well. We can also optimize marketability. So if let's say we're doing meat on dairy crosses, potentially having a tighter kidding window or breeding season can help us develop more uniform kid crops if kid sales are really important from a meat production side off the dairy, or even with high genetic merit animals, having similar aged cohorts can be really helpful for that marketability as well. And then especially for dairy production, minimizing the seasonality of milk production in dairy goats is one of the really important strategies that we'll talk about here. So certainly, we talk about reproduction, and there's certainly herd health and welfare implications that come with a really sound reproductive management strategy. So we'll go back to basics really quick, just so we're all on the same page, but just so we're all aware that goats have a breeding season. So we call them seasonally polyestrous animals, which means that they are short day breeders. They tend to breed as the days get shorter, so early autumn to late winter, but they go through multiple cycles during that breeding season. This is true for females and males. So when we talk about out of season breeding, that applies to the breeding behavior of both sexes. And then we certainly do see breed variation among this, especially, more northern breeds tend to be a lot more seasonal than breeds that were developed at more southern latitudes. All right. So just a little review of the reproductive cycle. This is a nice slide to have on hand when you're talking with your veterinarian about timing of protocols, if we're doing any kind of synchronization or things like that, because it really helps us understand why we're doing what we're doing. Why do you have to wake up, to give these injections or whatnot if we're doing some timed AI or synchronization protocols? So for goats, we know we have about a 21-day cycle typically. This is how much time it takes. Let me see. I'll use my pointer. Wait, I can't find my mouse. It's really weird. Okay, we'll forgo that. So if you can look just first on the bottom of the slide, you can see where there's this, it looks like little surge of concentration. So you can see where we call estrus, and here it says oestrus, but estrus would be when they start to display signs of heat. And that happens right before or right at ovulation. And so this is related to different hormone surges or like drops in progesterone. And, so you can see all the different hormones that are involved, PGF2 alpha, FSH, and they're all involved in follicular development and recruitment. And then we get this big LH and FSH surge that induces ovulation. The follicles that ovulate then form what's called a corpus luteum, and that corpus luteum is what causes the increased concentration of progesterone. And then if the egg that has ovulated becomes fertilized, then that forms the embryo, and that implants into the uterus, and there's signals within the uterus that can detect the embryo and tells the corpus luteum basically to maintain. And so there's a lot of these hormone signals just in this region around the uterus that are really important for successful reproduction. And we can kind of manipulate that if we have, in order to time some of these procedures, and also maybe to stop her from getting bred during a certain period of time, um, and then control when we do want her to have, a successful conceptus. Okay, so age at puberty does depend a bit on their breed. It can depend on their kind of mature body weight that's expected of them. Females, we expect them to be at least 65% mature body weight before we put them in with bucks, because that's when they're more likely to be successful with breeding. Um, their birth date, however, can affect their age at first kidding, or, if you backtrack from there, when they're likely to start cycling. So we can have, if does are born later in the kidding season, whether it's late spring, early summer, then they have a really hard time being this, 65% mature body weight before the next fall cycle. So we are more likely to miss those young does at that time if they're kind of at the tail end of that kidding season. So does that are born out of season, so maybe they're a fall or winter born doe, they're actually more likely to be able to be bred in that fall season, if that's the goal, because they've, had more time to reach that mature weight. The challenge, though, is if we want an out of season born doeling to be bred out of season again, if their time between being born and being bred does not overlap a fall season, they may also be delayed because they haven't had that decline in day length to kind of kickstart their cyclicity. So there are some strategies we can use to try to kickstart that cyclicity for them. Again, with the challenge being that it is a little bit variable in these young does. So we do tend to see lower conception rates with our doelings than we do with multiparous does. Right. So as you can imagine, nutrition is really important for the onset of puberty, for conception rates in general. It's been shown to be important for kid vigor, colostrum quality, and then what that milk curve looks like. So nutrition during pregnancy or before breeding is pretty critical. Having good quality feed, and depending on if they are multiparous does and in lactation, having access to energy in the form of concentrates. Other things preparing for breeding, because clostridial vaccines tend to have lower duration of activity in goats. We do, often will recommend doing our clostridial vaccines, whether it's a CD&T or if you're in a high-risk area for flukes or other clostridial bacteria. There are other Covaccinate or other multivalent clostridial vaccines. So working with your vet to decide what's best for your program. But with those types of vaccines, we do tend to recommend doing those twice a year. So that might be a pre-breeding vaccine and then a pre-kidding vaccine, because we do want those colostral antibodies for kids' survival. If abortions are a problem in your area on your farm, pre-breeding is typically when those chlamydial vaccines are recommended as well. All right. So another reason or another thing that, like we said, nutrition is really important. Overly fat does can also be a problem. So while we want them at a good body condition, when they're over like a 4.5 to 5, that can be really challenging to get them rebred or cycling. So just being cautious. This can typically happen when we have does that, dry does that aren't breeding back, and we'll talk about that a little bit later when that most likely happens. Another thing that we should be thinking about is breeding soundness exams for our bucks. So we also want them in good body condition and muscling, so that they can do their activities throughout the year. Make sure they have good feet, legs, eyes, teeth, and then reproductive organs like the external penis and scrotum. And then doing a semen evaluation is a pretty good idea, especially if we'll be collecting these males. All right, so there's different mating systems out there. So there's hand mating, where you will bring the female to the buck. So folks might do this because, if we're wanting to, be really sure of who she's bred to, then we will do this in order to be exactly sure of breeding dates and things like that. We might also do this if we, don't want to have the buck out with multiple bucks in a pen. Other reasons, for being really intentional about who he gets to expose. There is pen breeding, and this is where maybe one buck is in with a pen of females. So again, you are controlling who is exposed to him, but he's able to kind of, be a little bit more free about when and who he's breeding. The challenge with that is sometimes they will focus on one female, and may not cover all the females within one cycle. So because of that, we do try to limit how many females are with each buck. And so for younger bucks, it's, we say up to 25 females. That may depend on how vigorous the bucks are themselves. For mature bucks, they can usually cover up to 40 females in a pen. Pasture breeding, typically, depending on herd size, that's going to be where we have multiple bucks out there. This pasture breeding could also be where they're in a yard on a dairy, with multiple bucks in a pen with multiple does. If they are out on pasture and have more range, then that's where we need to consider how many females a single buck can cover if they have more walking to do in between breeding. Artificial insemination is also, it's a way to kind of be able to cover more does with one buck within one season based on how much, what's the concentration of the sperm in their ejaculate and how many does can be covered from one ejaculate. And then we'll talk more about out of season breeding. All right, so in some systems where we are doing pen breeding or yard mating systems, it's really helpful to know who is being bred by which buck, or even if we have one buck in one pen, we might change colors every cycle to know if females are breeding back, or if they're, maybe we can help us identify infertility issues, potential disease, so early embryonic loss, or nutritional issues that are causing some poor reproductive performance. So this is a way that we can catch this earlier than when we can maybe first ultrasound them. So this can help with some kind of, early problem solving, as well as getting breeding dates. And then, like I said, understanding which sire is covering each female. So who might be more have a higher libido, because we do see that where certain bucks will tend to cover more ewes than others, so that can be helpful as well. All right, so for hand mating, This is where detecting estrus in does can be important, and does are certainly a lot easier than ewes to detect estrus, so they'll do tail flagging. They might have some mucus from their vulva, but they will also be receptive to bucks when they're in estrus. If you don't, for folks that don't want to risk injury to maybe a really valuable buck, they'll use vasectomized bucks to test if does are receptive. Um, so that would be one reason to have those around. For semen collection, typically we can start with young bucks around 9 to 10 months of age, and they can be collected up to twice per week. For mature bucks, they can be collected more often. Usually their collection periods are limited for the 6 months between the fall and spring equinox, so the breeding season. That's when we tend to get the best quality semen from them, with higher concentrations of sperm. And they're just more likely to perform when they're within their breeding season because of breeding behaviors. There are photoperiod treatments, so out of season protocols that you might have heard about for females that are also helpful for getting a longer collection season from bucks. So you alternate 1 to 2 months of long days, which is 16 hours of light and 8 hours of darkness. This is typically achieved within barns, but it can be achieved outside with lights over yards. So there are some studies to show that that's effective. And then you alternate that with 1 to 2 months of short days. And so that's where you have 8 hours of light and 16 hours of darkness. As you can imagine, creating shorter days is really hard to do outdoors. So that would be more achievable within a barn system. So these bucks that are kept in these types of environments yield more semen doses annually than bucks that are collected within that 6-month period. All right, so for semen collection, typically fresh semen, we expect higher conception rates. We can definitely, we can see 75 to 85% conception with fresh AI with fresh semen. You can certainly have higher conception rates. A lot of that depends on external factors. However, with frozen semen, we do tend to see lower conception rates. This can very much depend on the buck themselves and the quality of their semen and how the semen is prepared and extended. So when we're talking about breeding soundness exams, we call progressive motility. So that is the sperm moving forward across the slide. We call them satisfactory if their progressive motility is over 30%. But you can see when we have a fresh sample, on average, that sperm motility is around 80%, which is, far more than satisfactory. But with that same sample, after it goes through the freezing process and then a post-thaw sperm motility can go down to 50 to 55%. So you can see a pretty big drop from 80 to 55%. So if we don't start with a high sperm motility, like if we started with around 55% on a fresh sample, post-thaw semen may not be satisfactory at that point. So that's where some bucks, maybe they start with a 50 and post-thaw they end up with a 50. It really does depend on kind of the quality of the semen. So that is always something that's important to evaluate if we're doing artificial insemination is post-thaw semen quality. And then we're also looking for the shape of the sperm and which is morphology, and expecting them to have greater than 70% normal sperm morphology. So, when we're talking about breeding in season, I mentioned how establishing a breeding window can help us with a very timed and planned kidding window. Typically, we're doing this exposing does for 2 to 3 cycles. That just depends on, what the objectives of the farm might be and what their labor resources are and their facilities, how many animals they can get bred within that time, and how many kids they can support during that time as well, that, window of time. So that can be 42 to 65 days, depending on how many cycles. The challenge with just putting a buck into a yard and exposing does for that time frame is that then we end up with a bell curve of kidding. Or the how many kids are born in a day. So this is an example from obviously a sheep operation, but you can see this is when bucks were, you know, if you calculated 150 days before when bucks were put in and when bucks were taken out. And so you do see a pretty high peak, and that can put a lot of stress on labor and facilities. So you imagine cleaning pens and all of these things get really challenging when you have that many kids being born at one time. So one way that we can try to manage around this is by synchronizing estrus in our does. So if we know we have does that are going into this breeding group, we might want to do timed AI. Or we might, you know, so we might want to do some sort of synchronization to try to manage how many does are being bred within each part of this kidding or breeding window. Other reasons that we might decide to synchronize estrus is if we are doing timed AI, especially if we're doing embryo transfer, both the recipient and the doe need to be right on as far as where they're the stage of the uterus, as far as being able to receive an embryo that's of the right age. So that becomes really critical for embryo transfers. And then, like I said, labor management and facility capacity. All right, so there are many different strategies for synchronizing estrus in goats. Some of them are taking advantage of maybe the presence of a CL and shortening that, what we call the luteal phase. So these are with hormones that we have access to with a veterinarian, using estromate or Lutalice. In goats, where we can do that 2 days apart. So this is where, looking at that cycle where the CL is present, if the CL is present, that first dose of PGF2 alpha is going to help that CL to regress. But if she's in a part of her cycle where she doesn't have a dominant CL, that first dose isn't going to do anything for her. So that's where that second dose becomes important, because then they will both have a CL. So the animals that had a CL at the beginning and don't will now both have a CL at this 11-day mark, and this second dose should capture them. And then those does should all come into estrus within 2 to 3 days. So it isn't it isn't timed. You can imagine within 2 to 3 days is a pretty wide range. And so for really timed procedures, that might not be ideal, but this can be helpful for making sure, does are being bred around the same time. This strategy also isn't really helpful if the does aren't cycling. So if they're in anestrus, which means they're in a phase of their reproductive year where maybe were at long days and they're not naturally cycling, there will not be a CL present. And so this type of protocol isn't really going to help us induce, have her come in to heat. So we can use strategies like an extended luteal phase. So these are progesterone implants. These are labeled for sheep. So it would be certainly extra label use to use these. But this is where, especially out of season, we might leave them in for 9 to 14 days. And then upon removal, that can sort of stimulate these anestrostoses to start coming in and cycling. In season, we can certainly have better we have better response to shorter duration, because as we leave them in longer than 7 days, that progesterone sort of naturally declines because it's not in the implant as much anymore. So we can get away with shorter insertion periods. And then when we do that, usually we're giving a prostaglandin on the day of insertion, so that if she did have a CL, it would get, help control that CL at that time. And then we should see estrus within 1 to 2 days after removal of the cedar at that time. For really timed AI protocols, there typically folks are giving some kind of GnRH agonist or FSH, and that helps to promote, really stimulate the onset of estrus activity and follicular recruitment development and ovulation, so that we get a more precise timing of when we can expect ovulation to occur. So there's certainly a number of options there. All right. For out of season breeding, like I said, there's certainly a lot of reasons why we might want to breed out of season. Potentially, we have more feed available for growth of weanlings. That's certainly true for us out in California. We have most of our feed is dry by July, or by end of May, early June. So if we have kids born in March and April, we're running out of kind of pasture resources by end of June, unless we are irrigating. But this can also minimize the seasonality of milk supply. We can also accelerate genetic improvements. So if, like I said, for kids that are born out of season, typically we can breed them a little bit earlier, at an earlier age. So we have shorter generation intervals between breeding, so we can kind of accelerate that genetic improvement that we're expecting to see. Certainly there are breed differences for, like I already mentioned, so like Nubians maybe having an extended breeding season compared to more northern breeds, but it's not, usually we don't think, oh yeah, they can breed all year round. This is certainly going to depend on your climate and your day lengths in your region. You might live in a region that really doesn't have these dramatic differences in day length. And so, that's certainly going to impact these programs. But there is certainly within breed variability. So this is where, if breeding out of season is really important, keeping replacement doelings from out of season matings can be a way to kind of improve how receptive they are. Okay. All right. So I mentioned the photoperiod manipulation. So this is where we, for females, there are protocols where we increase light for 60 days, so 2 months in January and February. And so they have 22 hours of light in the barn, and then 6 hours. So there's a 6-hour difference. And then the estrus cycles begin 4 to 6 weeks after the exposure to natural light cycles. So after this increased light, we stop with the photoperiod manipulation, and then in 4 to 6 weeks after we've stopped, they should begin to cycle. And so that would be right around March or April. All right, so, and then the buck effect, so having either a vasectomized buck or an intact buck in the same area as the females for 10 days can bring them in to cycling. That really only works if the buck was removed from the females, and by removed, it's like miles away. And it really also depends on how interested the buck is as well, so their breeding behaviors. So again, we mentioned the cedars and how these can kind of bring them into cyclicity. This is a different protocol where we're giving the PGF2 alpha on day 13 instead of the day of insertion, like the shorter protocol. And then typically after cedar removal, the buck should be in that group within 12 hours. And you might expect to see some coverage there. We can have improved ovulation rates if we give PG 600. Again, this is an extra label use, so we want to make sure we're talking with our veterinarian about using these drugs for reproductive uses. All right, so we can certainly expect to see lower conception rates with out-of-season breeding. So we do want to make sure we have enough, adequate buck resources. So where we said maybe a mature buck can cover 40 females within one season. If we're out of season, then we should certainly reduce that, most like maybe by half. Just because of his behavior, and then, how much, at least for his sperm quality, is going to be affected also if we're not doing any of these photoperiod manipulations. We can certainly conserve buck resources by hand mating, and then just understanding seasonal limitations. So there's certainly in the literature a fair number of primiparous does. So they've been bred once, and then if they're in an out of season breeding group for their next cycle, they are more likely to be culled if they don't get bred out of season, because otherwise we have to keep her dry until we are able to breed her the next time. So, understanding those limitations and how we might manage that, we'll talk about a little bit later, especially for kind of primiparous does that have only kidded once and are in lactation. And then, if we can stimulate buck activity ahead of group breeding, that, again, photoperiod is kind of the main way that we can really stimulate some reproductive behaviors. All right. There's certainly a number of reasons that we might see infertility in dairy goats. Infectious abortion agents is certainly probably about 50% of the abortions that we see are due to infectious abortion agents. That's just based on what the labs are able to, what they receive. And if placentas are sent along with the fetus, they're able to diagnose about 50% of those as infectious abortion agents. Non-infectious abortions can absolutely happen. So if we have fatal chromosomal abnormalities, that's just where that embryo is not going to be viable. That can certainly result in early embryonic death, and I believe that accounts for about 6 to 10% of conceptions can sometimes be these chromosomal abnormalities. Another thing to remember is we can have intersex abnormalities. And so those can either be genetic, so chromosomal abnormalities, or they can be developmental because of, if you know, of free martins and cattle, but just the different hormones that are potentially circulating within a uterine environment when you have litters of both female and male kids within the uterine environment. So this picture here is of a free martin that Dr. Fauna Smith has been working with. She looks very masculine in her facial features, and then you can see the enlarged clitoris. So those are some signs from a pretty obvious free martin potentially. Sometimes they're not as obvious. So there's a litter mate from this female that was also a female and looked very feminine, but was not able to be bred. So those are other reasons why you might have a pretty normal looking female, but she's still not receptive, or doesn't have the developmental capacity to be bred. Okay. It's supposed to be of. So we can certainly see variability of progesterone concentration and timing within the cycle. Certainly different ovulation rates. So does that are more likely to ovulate 2 to 3 follicles are more likely to conceive and maintain a pregnancy because they have higher progesterone levels. Nutrition is definitely a critical factor and can be certainly challenging when we have does that are in lactation. So there's, a cost of milk production as well as a cost of reproduction. And then environmental stress. So heat stress being pretty well recorded as impacting conception rates. But movement stress, management stress, those are all things that can certainly impact conception. And then there's some documented toxic plants that can interfere with conception or nitrate toxicity. They can also be teratogens, so cause birth defects, things like that. These are some questions that I've certainly had asked. Well, what about short cycle length? So this is where we see the doe might be cycling back every 5 to 7 days. So this is more common in young, lightweight does. Usually this happens early in the season. And what they think this is related to is a low LH peak. So it's like right when they're coming out of anestrus and coming into that estrus season, you get a low luteinizing hormone peak, which then either means that that follicle does not ovulate, or the follicle ovulates, but the CL never becomes a really good dominant CL. So we get kind of a recycling back in 5 to 7 days. So really the recommendation for this is to breed them after 2 to 3 cycles, and then usually those hormones are really surging. One way that we can try to manage this is by introducing a teaser male for 10 days. And then, so she's been able to go through those cycles. And then when she's exposed the next time, she should have a really productive ovulation with hopefully multiple follicles ovulating. This can look pretty similar to cystic ovarian disease, and I don't think it's very well understood if they are related or not. But cystic ovaries, you can have does that are cycling very often, or they are, we call them, well, they're always receptive. And so that is where, there are treatments to help try to stimulate ovulation of those cystic ovaries. It can typically on a skilled ultrasonographer can be diagnosed on ultrasound. And then there's pseudopregnancy. So pseudopregnancy is different from these cycle length issues that are more ovary tissue related. Pseudopregnancy is where we have a persistent CL with fluid accumulation in the uterus. So that's this picture on the right. These are more common in out-of-season matings and with extended lactations, as we'll talk about a little bit. So the challenge with pseudo pregnancy is that the females, they don't cycle back. They can even accumulate so much fluid that they physically look pregnant. And sometimes they'll maintain this status for 5 months and even come into lactation. So, okay, that's great. Unless you wanted a kid out of this. So not great. And the other challenge is that they can test positive on blood pregnancy tests. So this would be one reason that it would be really valuable to have your vet out to diagnose pregnancy with ultrasound, because that can be differentiated with an ultrasound. And then these can be terminated. So we just lyse the CL, and hopefully, then they their cervix opens, they evacuate the fluid and mucus that's accumulated if it's responsive. So. All right, so I know there's a lot of interest with extended lactations. There are some studies done in Northern Europe and in France on extended lactations, and then just some of the experience we've had in the States with some of these herds. So what they've found is does that, compared to a standard lactation, does that are in extended lactation for 2 years can have the same milk output as two standard lactation. So in theory, it can, you can get the same milk production, and then achieve a year-round milk supply. This can help with overcoming labor challenges around kidding season because, excuse me, as you can imagine, you don't have to breed every doe every year. So that can be potentially really helpful for herd health and kidding management. Because we don't have does pregnant every year, there are reduced peripartum metabolic stress issues, reduced risk of mastitis at freshening, which is that high risk period, which then extends doe longevity. So these herds that are implementing extended lactation might see more robustness in their doe population. And then when primiparous does, so this is their first lactation, are put into extended lactation, we can maintain milk production without the cost of reproduction, which then allows them to continue their kind of body growth. So that birth or the body weight that we want them to continue to accumulate, we can do that a little bit better if we're breeding young does and then allowing her to extend her lactation. She can continue to gain weight. So we can see a lot of benefits potentially to this type of model. So things to expect. We certainly have seasonal drops in milk production in the fall, and so that is something you might expect to see right around 300 days in lactation, but then they get a rebound at 330 days. And so the does that go into that are capable of doing extended lactation, they tend to be higher producing does than does that don't extend their lactation. They tend to have more persistence, which means their milk curve looks very different than does that are less likely to extend their lactation. So does that have normal lactations tend to have a peak of milk production after freshening that kind of scales down and declines over their lactation curve. These does have very little difference in their peak milk production and their kind of 300 days in milk production. So they tend to have a pretty flat line, which you probably saw. This graph over here was given to me by Dr. Mangini, so very grateful for her sharing this information with me. But you can see this is a doe that at the time this graph was taken, she's 1,250 days in lactation. So many years into lactation. And you can see that her milk production is really, pretty flat across there. It does decline a little bit, as you can see, right around 300 days, and then it peaks back up. So that's what you would expect, pretty typical of a doe that can go into extended lactation. What they do see is that while she may have really low somatic cells in her kind of normal, 0 to 300 days in milk, after 300 days, that somatic cell count does tend to increase. But what they've found is over their lifetime, the somatic cells are comparable to does that are normal lactation. So she's not contributing more somatic cells over her lifetime, if that makes sense. One of the challenges with this, because it's hard. Um, is it because they don't have that reproductive cost? It doesn't necessarily seem to be exactly correlated to that, but overconditioning is common in some of these herds if nutrition isn't carefully monitored. So at that 330-day mark, their dry matter intake increases, and so they can gain, you know, 10 to 20 pounds in that period. And because they don't have that reproductive cost, overconditioning can be a problem if we're not carefully monitoring that. So feed quality is really important to maintain the milk components such as milk fat and protein. So we certainly don't want to short them on quality feed. So this is an area of research that is ongoing, certainly in Europe, but we definitely need more information to better manage our body condition and productivity of these does in extended lactation. One of the drawbacks is certainly because we have fewer kids born to these used does, that we have slower opportunities for genetic improvement. And then we have fewer replacements. And then if kid sales are important, we certainly have fewer kid sales from these dairies that are utilizing this management system. So if this is a management system that looks really exciting, we definitely want to make sure we're very intentional about this. So this is where making breeding and culling decisions need to be clearly defined in order to maintain a high producing herd. So the replacement rate is going to change, right? We'll likely have fewer culls because our does aren't having the same high risk periods with mastitis or related to metabolic disease. So we can expect that rate to change a little bit. Another way to So one thing that needs to be better defined, and I'll mention this in the next slide, but that we don't have a great way of identifying which does are going to succeed as an extended lactation doe early on in the cycle. So right now, looking at daily milk weights or at least monthly milk weights so that you can evaluate the slope of the lactation curve is the best indicator. Like I said, if she's a high persistency, high producing doe, she's most likely to succeed as an extended lactation doe. And then monitoring somatic cell count and udder symmetry, which might be indicators of chronic mastitis, would be really critical from a herd health perspective. If we have does that have subclinical mastitis or chronic mastitis issues that are in these extended lactation curves, that just increases our risk of spreading those pathogens through a milk string. So we want to make sure that we have healthy does, productive does in this lactation group. The other part of that is establishing breeding groups. So it is recommended to, because it is helpful for these primiparous does to extend their lactation because it helps their growth and development, we intentionally cease that lactation at 2 years. So she's bred as a 3-year-old. So one, if she's very successful as a extended lactation doe, then we can hopefully get replacements from those does. But also we're being more intentional about getting replacements again, and also just trying to manage her growth rate, her conditioning. So that is kind of the recommended strategy from a lot of the papers that I can find out of France, is extending that first lactation and then breeding them after 2 years of lactation. Some of these does that do extend that first year fail to extend ever again in their lifetime. So that's just something to be aware of, is not all extended lactation does will extend their lactation for the rest of their productive life. So that's something to, again, we'll need to monitor her lactation curve and try to prepare, because if we don't prepare them for breeding around that 240 days in milk, we're going to end up with a lot of dry does that had delayed breeding because we thought they could extend their lactation because she did before, and she doesn't. So this is another reason for overconditioning, having a lot of dry does on farm. And you can see how, if not monitored really quickly, we can end up in a situation where we actually have lower total farm productivity because we have fewer does in milk. So we want to make sure that we establish breeding groups intentionally, that we have extended lactation pens. So does that are beyond 330 days in milk are in a different pen that has its own ration. And then establish thresholds for when we would choose to extend her lactation, rebreed her. Yeah, so based on either the shape of that curve, production volume, all of those characteristics come into play. Another piece that would be really important is assessing profitability and labor efficiency with this type of production change to make sure that it is actually profitable and improving production. So, because you can see there are a lot of there are certainly a lot of moving pieces with extended lactation herds, a lot to keep track of, but certainly could be a lot of benefits for longevity of these does, and going from there. I think there are certainly future research needs within this type of production system, like I said, with criteria of selecting for extended lactation does before that kind of breeding window for a normal lactation doe, and then nutrition strategies, the heritability for persistence. So those does that are maintaining that production level over the lactation. And then there really aren't any standard reproduction re-entry protocols for these does, so that could be improved as well. So that is what I have on extended lactation. If you are really interested in advanced reproductive technologies, there are a handful, I wouldn't say a lot of veterinarians, but certainly a handful of veterinarians that are happy to provide these services. There, certainly benefits in increasing the rate of genetic gain, maintaining herd biosecurity with these techniques, and then we can do that with transvaginal AI, laparoscopic AI, or embryo transfer. The QR code here is for that, I believe it's a 7-module course that Cornell University developed on AI for goats. I think that's a great place to start if that is something that you are interested in. And then just the importance of pregnancy diagnosis. So predicting dry off dates, nutrition management, whether if they're bred versus open, managing them even by single versus multiples, and then managing open does. They can go into an alternative breeding group, whether that's the out of season breeding group, and then with if they're showing signs of estrus when you expect them to be bred, this can help you determine the health of the pregnancy, whether or not it's a pseudo pregnancy, like we mentioned. So the blood test, there is a blood test for detecting progesterone. It's accurate after 28 days. If they're not bred, then you usually see that recurrent heat at 18 to 24 days. So you might see them come into heat before you are able to do this blood test when it's accurate. Again, you can't differentiate pseudo pregnancies. Um, and then it can be really challenging when we don't have known breeding dates. So transabdominal ultrasound is certainly recommended. We can start to see signs of pregnancy as early as 30 days, sometimes earlier, depending on the size of the doe. And then, yeah, it's a great reason to have the vet come to your property. So that is what I have, and I'm so grateful for everyone's time. I saw one question that went through, but I really didn't stop to look at questions. So if we have
Yeah.
time, we can.
Yeah, we got some time if you're okay with staying on for a few more minutes.
I do have a meeting, but I'm okay to stay on for a few minutes. So
Okay.
yeah.
Yep. As we take the questions here, just a reminder, I did put the evaluation link into the chat. So before people log off here, if you wouldn't mind clicking on that so we can get feedback on the webinar here today. There was some questions that came in. I know one of them got answered as you were talking, so we won't go to that one, but there is a list here that Jordan had put together for AI. Our synchronized heats, they have a lower conception rate than natural heats.
That's a great question. I think it depends on the operator, honestly. With AI, when we synchronize, we can really time when we expose the dough to make us more likely to get a good conception. So I think you can have, I think you can have actually better outcomes with synchronizing if we're doing AI. So
Okay. And then I think you went through the protocol for synchronization, right? In your,
yeah, I went through a few. There are
yep,
many.
yep.
Yeah.
Um, they were just asking what's the best for AI, the synchronization, but maybe if they review your handout, they can go through that.
Yeah, and the Cornell, that QR code they certainly go over a number of protocols because that is
Okay,
like a whole artificial insemination course.
great. And then in general, how successful are the lap AIs? What's the likelihood of a lap AI causing infertility in does?
Um, so lap AI, I wouldn't say is used very commonly. If we are using it, it's because either the semen is of such low quality that we really just want to get it as close as possible to the ovulation. So we'll put it in the horn where the follicle is. Um, so if we're doing lap AI, it's because either the doe has got some reason why we can't go transcervical, or it's usually because of the quality of the semen. So I would say I would just expect that to be a lower success rate just in general.
And then are there does that just don't respond to hormones for syncing? Any management strategies for syncing these types of does, or are the best bred on natural heats?
Oh. Um, so there's certainly going to be individual variation with regard to cycle length, their kind of, amplitude of hormones and things like that. So yes, there will be individual variation. Um, as far as how to manage that, that's challenging. I think it's going to depend on the specific scenario, but that might be where a buck effect can be helpful to get better amplitude out of her kind of hormone production, and then go in with your synchronization protocol so you can specifically manipulate or breed her specifically to that fresh or frozen semen that you have.
All right, looks like there's two more questions. You got time for two more or?
Sure, sure.
Okay, all right. Can Jimson weed, also known as Datura plant, cause stillbirth or fetus deformity?
Ooh. I don't know that one off the top of my
Okay,
head. I apologize. Sorry.
yeah. And then how does heat stress in July or August affect breeding in late November? And just as a follow-up to that, I also had a question about heat stress because in cows, we usually see that we use a temperature humidity index around 68 degrees Fahrenheit. That's when we consider cows in heat stress. So is there a number that you use that does are considered to be in heat stress?
Oh, yeah. It's higher for goats. Goats are a lot more tolerant to varying climates, but it's not that much higher. Um, I don't have it right off the top of my head, but I definitely have there's a really neat review on thermoneutral zones and how goats are so, very different from a lot of our other ruminant species. So they do tend to be more tolerant of these different kind of climate environments. But that said, especially in our northern breeds, they wouldn't necessarily be as heat tolerant. But as far as heat stress in July or August affecting breeding in November, I wouldn't expect a delayed effect from that. So.
Okay. Um, This comment here about we've been doing extended lactation for the last 7 years, and for us, 2 to 3 years works best. Longest so far is 3.5 years. So appreciate that comment.
Yeah, that's awesome. Thank you.
And um, one last question. I had a doe that needed to be treated for toxemia at the end of her pregnancy and then was on an extended lactation for milk testing. I paired her with a buck last year, but did not take and has been short cycling off and on. Is there a way to help her get back on track?
So that is part of the re-entry protocols that we really don't have for the extended lactation does. It has been shown that these high production does that have high persistency, and now we're seeing that can do extended lactation, they can have challenges with being bred back in. But because of I would, if you haven't already, get an ultrasound, see what part of her, if it's anything on her ovaries or uterus that seem to be off, that might direct the treatment that is recommended, because it'll be different if she's short cycling because of just kind of, she doesn't have the amplitude for her hormones. The recommendation for that will be different than if she has cystic ovaries. So trying to get a diagnostic ultrasound would probably help guide that a little better.
Okay. We had another question come in. Are you okay with sticking on for one more? I
Yeah,
can
one more.
also, okay, I keep saying that, but any testing available to test bucks for genetic issues after kids with issues so we can see if it was him or the non-genetic cause during the pregnancy?
Oh, so we do have genetic tests available. Not many, most of them are for, like milk quality. We don't have a lot of tests that are specific to congenital deformations in kids. So that is something that could be developed further. But unfortunately, we don't have a lot of genetic tests specifically for that. So, yeah.
All right. Well, I appreciate you answering all these questions. A lot of good information here today with your presentation. A lot for us to think about in the dairy goat world as we talk about reproduction and kind of maximizing that production. There was a question on here if this will be recorded, and it will be. So we'll get it out on our YouTube channel as soon as we can get it edited. So give us about a week, and then we'll get that out to you. So you can view it again. But appreciate everybody sticking on here today, and we look forward to seeing you on December 17th, and we'll wrap it up from here. Thank you.
Thank you.